So my name is Dr. Jenny Pederson, and we are based out of Harare, but today we are carrying out a pro bono or free of charge clinic here in Bulawayo in collaboration with the Ear Center and the local audiologist who is Mkonzeni Zibanda. And Here to Aid is our organization. We are based, a Zimbabwe-based foundation, and our aim is to help children who are hard of hearing from age 18 and under from low-income families. And I got a question previously in terms of how do you decide who's from a low-income family. And we're of the ethos that if you as a parent were able to do something for your child who you think might have a hearing loss, you would have done it. So the fact that you're having to wait for a program like this to come to your area, that automatically means that you were unable to do it on own means, and those are the people that we're targeting to help. We're carrying out full diagnostic testing today. I think the youngest we've seen was about 16 months, and the oldest we've seen was about 16 years. So we've had a full scale in terms of the age groups that have come. And actually out of the, I think so far we're tested about 40 children, I think. Out of the 40, only 6 have normal hearing. So which means parents have obviously noticed the signs. Child has delayed speech or is not reactive when spoken to, and they've identified the signs and have come appropriately. So this is quite unusual for us because quite often we get a lot with normal hearing where parents just want to check if things are okay. But actually today about 90% actually have hearing loss that needs a hearing aid for remedying that. So we are looking at wax removal, foreign body removal, checking for active infections. Then we're doing a hearing screening. If the hearing screening is normal, then they can be on their way. If the hearing screening is abnormal, then they go on and then we do full diagnostic testing. That will then identify the level of the hearing loss and what type of hearing aid that the child will need. And then we do an oral impression, so we make a copy of their ear, which we're then going to send to the lab in Harare to make custom-made prosthetic for the child. These things can't be out of a box, it has to be specific to the child. And once that's done, they leave for today and then they'll come back here on Thursday to have the hearing aids fit.
Okay.
Yeah.
So how long does this hearing aid last?
So usually, in countries where you're getting it within a government offering or something like that, they would renew you every 4 to 5 years. And that's because that's the expected lifetime of a hearing aid. With children, we find sometimes less because, they're climbing trees, they've got other siblings around, so we see more repairs needed and more replacements needed, which we also make sure that we can cater for within the program. Quite a lot of the people that have come, they were able to get their child tested because the testing is not the big expense. So they got their child tested, it was confirmed beforehand, before today, that the child needed a hearing aid. And then when they found out the cost of the hearing aid, that's where the problem now comes.
How much is a hearing aid?
So usually, a customized audiologically fit hearing aid will start at about $500 a piece, and it can go up to $2,500 a piece. So the devices that we're fitting here, they're like mid-range. So each family will leave with instrumentation in the order of $2,000 to $3,000 in value. So you can see why it's a big hurdle for anyone. I mean, if I had a hearing impaired child, I would also struggle to find that kind of money. So that's the big partnership that's important, is the people who are providing the hearing aids. And we're getting those donated from a Danish manufacturer called GN Great Nordic. So they make sure that we have enough for all the kids that we see, and we have backups in case they get damaged. And once we start to take care of a child, it's not a once-off. We have to actually see them every year. So right now we have 900 children in our ongoing care, plus whoever we end up adding today and tomorrow. Yes, we'll see them once a year. We'll check that the hearing aid is working how it's supposed to be, redo the prosthetics because the child will have grown. So quite often the prosthetic that we made doesn't fit anymore. And if there's damage, we do repairs. And if it's unrepairable, we do replacement. And that's on and ongoing until they reach the age of 18.
Okay.
Yeah.
You said that most parents have noticed that the children is a real problem. Is this like a normal trend, or the numbers are growing?
I don't think the numbers are growing, but I think awareness is growing, which is a good thing. There's a very natural reason why awareness has been low, because we haven't had very many audiologists in the country. When we started practice here in 2013, I think we were about 8 or 9 audiologists for the whole country, and the number has actually dwindled from there. We're now down to 7, which for a population of what we have, that's very, very few. Ministry of Health is doing a lot to try and combat the need and remedy the need. So UZ in Zimbabwe is now qualifying audiologists, and the first cohort actually graduates this year. So access to care will improve, and once access to care improves, then awareness will also improve, which means that instead of someone thinking, oh, this child is just stubborn or they're ignoring me, they'll actually know what the signs are of a child that has a hearing loss and can then seek help earlier. Because what we're sadly seeing also is a lot of the kids we see are quite old, because maybe they didn't develop speech early on, and then when you talk to your family practitioner, maybe they're advised to wait for school age. But actually, ideally, we want to identify the hearing loss before 3 months of age, and we want to actually remedy the hearing loss before 6 months of age for them to develop speech 100% normally. Not to say that these 5-year-olds or whatever ages that we're seeing won't develop speech, but they won't be 100% on par with their normally hearing peers. There will be some delay. Maybe some of the pronunciation won't ever be 100%, whereas if the earlier we catch them, the better the outcome.
Yeah. So how long has it been running?
So we, as a foundation, since 2018, that's when we started to form it with the board of trustees and all of this. But in terms of the work, we've been carrying it out since 2013. As soon as we set up practice here, we realized there was a need, and we've been carrying out the work. But then, now that we're a foundation, we were able to get partners, which then helps to cover costs of things like hearing aids and things like that. So that's made it more sustainable, and it's allowed us to bring on more children. Because like I said, once they're with us, they're ours until they're 18. So we need to make sure that each year that's to come, we're able to see them and cater for them. Yeah.
Now, what about this particular program? It runs up end of the week?
Yeah, so we weren't sure what the turnout would be, so we actually advertised for testing just for today. Everyone that showed up today that won't be reached to be seen today, they have been slotted in for tomorrow. Then the prosthetics, the mold impressions go off to Harare. Prosthetics come back Wednesday evening, and then Thursday everyone receives their hearing aids. So the goal for us is to see 100. To give it context, and usually in a clinical day as an audiologist you see 4 to maybe 6 patients. So the fact that we're able to see 50 in a day, it's quite impressive. Yeah, we've got 10 clinicians on the ground today. 6 of us came in from Harare, and the other 4 are located here. Yeah.